there, I'm Dr. Maureen O'Keefe from Purple Mountain Physical Therapy, and I and my team of physical therapists specialize in treating interstitial cystitis or you may call it painful bladder syndrome. I've been doing this work now for 25 years, and IC is one of my things that I hold near and dear to my heart. I've treated countless IC patients over the years, and I want to give you some insights into what physical therapy should include for you if you experience interstitial cystitis. First, one thing to point out is that IC really is a chronic pain syndrome that lands in causing you to have bladder symptoms. Quite often it's that urgency, frequency, pain when you pee, pain when your bladder is filling up, and constant constant urge to pee. As part of physical therapy, we need to treat you holistically. So here at Purple Mountain Physical Therapy, we provide myofascial release, connective tissue mobilization, visceral mobilization, scar tissue work, and bladder calming therapies. So what does that look like? That will look like a full treatment of hands-on, advanced kind of massage treatments, from your shoulders all the way, it could be down to your feet, because the bladder has connections up in your shoulder blades and in your mid back, your low back, your tailbone, inner thighs, calves. So if we want to calm down pain and bladder overactivity, we will be treating all of that. We also include gentle care to your pelvic floor muscles themselves. We find our patients with interstitial cystitis tend to have high-tone pelvic floor dysfunction, meaning the muscles are stiff and have trigger points. So with your permission, we would provide gentle internal work dressing these muscles to try to get them to become more soft and function better for you, and stop giving a message to your brain that you need to pee all the time. We include exercise-based care based upon whatever we find with you. Some people benefit from strength and conditioning of their hips because the glutes are not firing correctly and they have weakness in that region, which is then causing the pelvic floor muscles to compensate and drive up that stiffness and tone in the pelvic floor. Other people have problems with their posture, and when you have chronic pain, it's really common that your posture will go into this guarded position, and we will work to restore that for you. Those postural adaptations will alter your rib cage and your breathing, and that messes up your pelvic floor actually, because the pelvic floor muscles react and respond to the breathing. We check every nerve that's coming out of your spine and going into your abdomen, your hips, or your pelvic floor. Anywhere that you might have pinched nerves or you have connective tissue that is not as healthy as it could be, we are treating that to bring blood flow to the area and calm down those nerves. Most importantly, what we do is teach you what you can do at home and how to manage this. This, as I said, this is a condition that is near and dear to my heart, and all of my staff and I provide this holistic care with one-on-one appointments with you at every visit. Each appointment is up to 55 minutes long. We provide them in person here at Purple Mountain Physical Therapy in Grand Rapids, or we offer telehealth consultations for people who qualify. And what we want to do at each visit is create a healing and safe place for you to receive your treatment. And it's a whole body treatment. It's a neural calming treatment. We use things like heart rate variability training to increase your vagal nerve tone and calm down some of your sympathetic fight or flight. We use the breathing exercises, postural correction, the hands-on care I've already mentioned, and education about what you can do food-wise, nutrition-wise, and working with any complementary providers. I hope this has given you a sense of what we offer here at Purple Mountain Physical Therapy. And if you need help, I invite you to call at 616-516-4334. We have knowledgeable people answering our phones here, and we're happy to answer any questions you have. Good luck.